Hi, my name is Jennifer Spargo, and I'm here today at the request of the CDC, or the Centers for Disease Control, to increase awareness about a very deadly and incurable disease. What disease, you may be asking yourself? Well, that disease is Ebola Hemorrhagic Fever. Many of you may have never heard of Ebola Hemorrhagic Fever, and that would be because it's never been present here in the United States as of today. The worst effect of Ebola hemorrhagic fever, in my opinion, is the bleeding. The disease causes a human to bleed internal and external until they bleed to death. Ebola hemorrhagic fever is the most often fatal disease that carries a devastating mortality rate of 88%. Ebola hemorrhagic fever affects both humans and non-humans. Thankfully, its appearance has been sporadic since it's first recognized in 1976. Ebola hemorrhagic fever is also known as Ebola HF, and it was named after a river in the Democratic Republic of the Congo, formerly known as Zaire in Africa, where it was first recognized. The disease is caused by infection with the Ebola virus. Currently, there are 5 identified subtypes of the Ebola virus, with 4 of the 5 causing disease in humans. The origin of the Ebola virus remains a mystery. However, scientists believe it to be animal-borne. As of today, no cases of the disease have ever been reported in the United States. However, anyone who travels in and out of the United States to other countries on a regular basis should be on guard. Vaccinations should be up to date, and you should be tested often to make sure that your exposure to any diseases is caught on time. Even though Ebola hemorrhagic fever has no known treatment or cure, we do not know for sure that our vaccinations would not work against it. So it's very important to keep these up to date and protect yourself as much as possible. There have been threats of using the disease for biochemical warfare. With a mortality rate of 88%, such an act would be devastating. Any threats that are made in today's society with terrorism at large, as badly as it is, are not taken lightly and are taken care of immediately. If you know of anyone who's made any threats, please contact your local law enforcement. Infections with this virus are very sudden and appear to have no carrier stage. The incubation period can last anywhere from 2 to 21 days. It would have the following symptoms: fever, headache, joint and muscle aches, sore throat and weakness, which would be followed by diarrhea, vomiting, stomach pain, red eyes, hiccups, and again the bleeding internal and external. Once again, the manner in which this virus is contracted remains a mystery and is unknown, but it is thought to be through contact with infected animals. The virus can spread through contact with blood and body fluids of someone who is infected, or with contact again with an animal. Since so little is known about this disease, special precautions should be taken if you suspect someone may be infected. People who have jobs in the healthcare field should especially use precautions such as gloves, the mask, and gowns to protect themselves from anyone who comes into their office or into the hospital that may be infected with this virus. Scientists have yet to understand why some people survive this disease while many do not. Again, currently there is no cure or any treatment for the Ebola virus. I hope that this information is helpful and that we can continue to keep this deadly disease at bay. If you have any further questions about this disease or its effects, you can contact the CDC or Centers for Disease Control in your area. Thank you and good night.